A day after Ghana's premier health institution, the Korle Bu Teaching Hospital, stopped admitting cholera patients, the facility is still dealing with high numbers of cases, especially referrals from other hospitals. By midday, the Korle Bu Polyclinic had treated and discharged 30 patients and recorded one death, a 10-year-old child. This brings the total number of deaths to 10 from Monday. Justice Forsen was there and brings you this report.
Ghana has recorded about 5,000 cholera cases since June 2014 with nearly 40 deaths. The Korle Bu Polyclinic remains the hardest hit, being a referral hospital. When Joy News visited the polyclinic, a new structure was under construction to help accommodate more cholera cases. This is in addition to the existing makeshift structure and the corridor, which has already been turned into cholera bay. The hospital said on Wednesday it has resorted to treating patients in wheelchairs. At 12 noon, the news team observed more patients were still being conveyed to the hospital. The disease controller at the polyclinic, Abigail Owusu, said interrogation with the new patients indicated most of them are relatives of patients already admitted at the clinic.
The main problem we have is the relatives. The relatives whose patients are being detained, they come to the patients every day. When you drag them away, they will still come back. They think you don't want them to come close to the patients, but it's not like that. When they come, they just take the disease back to their house. It could be that the person will come back. If the person doesn't come, he or she will be a carrier. Then he or she will be giving it to other people.
Abigail Owusu said the polyclinic is currently organizing outreach programs to educate relatives of patients when they send them for treatment.
We talk to them, we show them what to do with the things they were using when they were detained. We tell them when you go home, put the water that you use to wash your things that you used here, you should put Dettol or Parasol in it, wash it nicely, dry it in the sun, and after iron it very nicely, and then you add it to your things. But they don't listen. So that is why some go and 3 days time they come back.
Some of the patients at the hospital shared the experiences with us.
Early in Monday morning, I brought my boss to the hospital here. Before around 6 o'clock, before I realized, I started all of my body just lose concentration. I'm vomiting, going to frequent toilet and those things all. And I said, okay, then I need to rush to the hospital. And I came here, all they could tell me is cholera.
The Monday evening, I bought a porridge at Zongo. So after taking the porridge, around 3 o'clock, I started running. So the first one I thought it was just normal. After the first one, I decided to take water. After the water too, I vomited all the water. So around 3, 5, 6, around 6 o'clock, I died. I nearly died. Yeah, so I was carried to the hospital and I've been discharged with 56 trips.
A visit to the lab polyclinic also indicated the hospital is still receiving increased number of cholera cases daily.
The phone lines to speak with the Greater Accra Regional Health Director, Linda Van Otu. Good evening, madam, and thank you for your time.
Good evening.
Korle Bu is at its breaking point now, and it is very obvious. The number of cholera...
There's a lot of noise where I am.
Okay, see if you can hear me this time. I'm saying that Korle Bu is at its breaking point. Now, the number of cholera patients continues to increase. This hospital, doctors are telling us, is a referral center, and so they have to make room for that. What becomes of patients as the number continues to increase?
We are asking about the numbers of cholera cases. Is that right?
Exactly. I'm asking about the fact that the numbers are increasing and Korle Bu is at its breaking point and may not be able to take in more patients.
Well, first of all, let me say good evening to the listeners. And unfortunately, the numbers are increasing because the environment in which the organisms are thriving still exists. There's been a lot of education in terms of what people could do to prevent themselves from getting the infection. One key one is washing of hands. We have done an analysis of what is happening, and we find that those who prefer to buy food from outside are getting the infection more. Those who are not washing their hands very well with soap and water are getting the infection. And then unfortunately, those who buy water from outside, probably because of the way the water is handled, are also getting it. Another thing is that we expect people, as soon as they find that they're having diarrhea, to rush to the nearest hospital. And as they do that, they can start drinking ORS. The environment, if you look round, is very filthy.
Yes, but that is
Yes.
granted. I mean, that's a very known fact already, and
Yes.
these are things that we've heard over and over again. But what I really want to find out is how the health service is hoping to contain the numbers, because it keeps increasing. Now the education has gone on, but we're still recording more cases,
see,
and Korle Bu
yeah,
cannot take in more. So what are we doing to contain
Yes,
the
when you
numbers?
talk about what the health sector is doing to contain the numbers, that's what I'm trying to explain. That
Okay, go ahead, please.
what people do for the disease to come is within the community. It is not just the health sector. We give the education, we give the treatment. But as to whether people will wash their hands, whether they wouldn't buy food that is exposed, whether they will not buy food that is too cold, that one, the health sector cannot do much about it than to educate the public that it is not the right thing to do. We cannot do this all by ourselves. We have not been able to get a place that you say that this is solely for the treatment of cholera, because we don't have anything like that. And that is why every facility has been mandated to treat the cholera cases that come to them. If
Right.
Korle Bu doesn't take them now, there's no way that we can say that this place is solely for cholera, to send them there. So we are and treat every facility to try and treat those who come to them with the infusions, with whatever they can do to help them to survive. And then we continue with the public education. That is very, very key. The public education is key, because that is why the people keep coming. For example, you find that in the Accra Metro alone, in one day, we get almost 150 cases, just one metro in a day,
Well,
which
Doc,
means that the people are still doing.
not to cut you there, Doc, but the Korle Bu Teaching Hospital now has constructed, or is constructing, a new wooden structure to be able to accommodate much more patients. But at the other health centers, what will your outfit be able to do when it comes to opening up, probably, to contain the increasing numbers?
For now that we have the outbreak, we have tried to create more space by taking part of the outpatient department, which was previously used for general cases, to add on. You know, in some of our facilities, we have the wooden structure, but it's not big enough.
Okay.
In some places, we have just about 11 beds, but they have more than 11 cases. So we need to create more space, which we have done using existing facilities within the hospital or the health facility. So that is what we've done. And we try to get the people to separate those who are coming from general cases from those who are coming with diarrheal cases, so that they don't get infected as they come to the hospital.
Do you have any plans of reaching out to private hospitals with a particular plan? Maybe they could also start opening up?
Yes, they are also involved. You see, some of our districts do not have government hospitals, they have private hospitals. So they are also on board.
Okay. Thank you very much, Dr. Linda Van Otu is the Accra Regional Health Director, Greater Accra Regional Health Director, speaking there about what we intend to do to contain the ever-increasing numbers of cholera cases.